Okay, so I am here with Nick Hedges or Nicholas. Do we go Nick, Nicholas? Do we going formal or informal? What's the best
I
way?
usually go by Nick, or actually, there are a lot of Nicks. So weirdly enough, a lot of people call me Doctor Nick. I don't know. You can call me whatever you want, though.
All
It doesn't
right,
matter to me.
all right, Dr. Nick Hedges. Nick, can you describe or tell people a little bit about yourself for people who don't know you?
Sure. So I, by trade, am a sports chiropractor or a rehab chiropractor. So I went to chiropractic school in St. Louis, Missouri. Coming up through high school and college, I was always a runner, which kind of began my fascination with the lower extremity. And then I got injured a bunch running. So I actually was scheduled for an ankle surgery, and I wasn't supposed to do any impact activities for my ankles. So I picked up rock climbing and top rope heroing, and that's how I started rock climbing. And then I really fell in love with rock climbing as a sport and as a recreational activity. So I got really psyched on rock climbing, especially while I was in undergrad and then chiropractic school, which led me to joining the climbing SIG, the climbing special interest group that you lead. And since then, I've gotten more and more into climbing, and I've moved out to Colorado, and now I'm in clinical practice out there, rock climbing, running, skiing, all that good stuff.
That's awesome. And yeah, I always remember, I mean, we both have similar backgrounds, with track and field and then getting into climbing. I know your injury was your ankle, mine was my hamstring. But I'm actually kind of excited because in this episode or this discussion, we're talking about the importance of the lower body and especially the ankle. And when you were in the climbing special interest group, you had written a great article that I still think if people, it works for me. I don't know for other people, but if you type in ankle sprain rock climbing, it's the first thing that comes up in Google search. So it's a pretty well laid out article. And so I wanted to talk about the importance of lower extremity in climbing and also the importance of the ankle, and then diving into the article and some of the insights that you have. So I'll just open it up with, I mean, what are the, like, there's so much emphasis on the fingers in climbing and the upper body. What are your thoughts on, is the lower body, does it matter, is it important? What do you think?
Well, I think that you're exactly right in that if we look at in terms of injury prevalence, obviously it goes fingers, shoulders, wrist, elbow, etc. So that's where the majority of people's attention is put to is I need to just train my fingers to become as strong as possible. I need to make sure I don't hurt my shoulders, etc. But then if we look at some of the biggest things that have occurred in the media in climbing, if we think about the film Free Solo, Alex Honnold, the main conflict in that was actually the ankle sprain. That's what kept him from that first attempt at free soloing El Cap. If we look at this really cool book that I picked up, Climb Injury Free, on the second
That's my
page,
book.
yeah, on the
Yeah.
second page, we've got Sasha here, and she's one of the greatest female climbers of all time. And one of the injuries that she notes in here as being a detractor from her performance was tearing through ligaments in her ankle. And by knowing what we know about injuries that occur in the ankle, we know that it was probably something like an inversion ankle sprain that occurred probably from falling off of a boulder. I know a couple of years ago, Jimmy Webb had to cut a Switzerland trip short because he fell off a boulder and sprained his ankle. That's on the mellow climbing thing. So I feel like, I don't actually know Jimmy Webb at all. I just like their channel and
It's
stuff.
public knowledge, yeah.
It's public knowledge, right? And then if we think about Tommy Caldwell and some of the recent lower extremity injuries that have really detracted from his performances, we can really see some of the most popular and highest performing athletes maybe overlooked some of these lower extremity injuries. And it was a really big detractor. And for these individuals, these are things that really can affect the amount of money that they make because they're not able to get these first ascents or free solos or able to train like they would. And then all of these individuals are really like the neurological savants of rock climbing, right? They're able to rehabilitate very well and probably get a lot of really great professional help. There's a reason that they're amazing rock climbers. And part of it is that they have amazing coordination and amazing recovery abilities. So it makes me think about the normal person like you and I who fall off of a boulder and get an ankle sprain, and maybe that's a grade 1, grade 2, or grade 3 ankle sprain. And what does that recovery look like? Approximately 23,000 ankle sprains occur in the United States each year, and 50% of those ankle sprains, 50% of those people don't actually seek medical attention. So they're not getting guidance as far as how to return to their activities as good as or even better than they were before. And we know that the recurrence of ankle sprains is really high. So one thing that does happen is once you injure your ankle, you're more likely to injure your ankle. And I know a lot of people that have previous injuries and injury history of their ankle, whether they played soccer or have been rock climbing for a long time, and they're like, oh yeah, I sprain my ankle every year. Every springtime rolls around, I sprain my ankle when I get back into running or bouldering season. And that really sets the stage for something called chronic ankle instability, which is a very nefarious component of this seemingly innocuous ankle sprain. Because if we let someone go to chronic ankle instability, then this can be something that later on will lead to ankle arthritic changes. And we're pretty good at replacing some joints like the hips and the knees and to a certain extent the shoulder, but the ankle joint replacement really isn't where I'd like to see it for me to be like, yeah, just get the ankle replacement. It's just not where it's
Well,
at.
and it's interesting you bring up, I mean, ankle sprains are so prevalent. I mean, there's even been some recent articles on it's one of the most prevalent lower body, emergency room acute injuries, in rock climbing. But you brought up that good point that, the stat you mentioned that over 50% of people don't see anyone for that because you just walk it off, right? Most climbers, I sprained my ankle. Okay, let me walk it off. Well, the ankle stiffens up, and then you're going to be walking a little different, and you can't really toe down as well or drop your heel, and then it starts to carry up the chain. And so, yeah, it's a pretty fascinating body region. I think the other thing I want to add too is there's a lot of talk about bouldering falls and sprained ankles. Um, I sprained my ankle. One of my to date most annoying injuries. It was on the face of Half Dome or the northwest face. It was a pendulum injury, and so I actually slipped on a slab part of it. Took a massive pendulum and then dorsiflexed or hit my toes into the wall. My ankle bent backwards, and that was a terrible something that I wasn't even expecting. The ankle moved in a different direction, but I mean these are injuries. They're very prevalent. They're very common. Is there any before we dive into once you get an ankle injury, what to do about it? Is there any tips that you can give about maybe how to self-assess if someone's susceptible for it, or maybe how to reduce the risk for injuring an ankle?
Yeah, there are a ton of self-assessments that are available. A lot of these are through, organizations like the SFMA, Selective Functional Movement Assessment, and things like that. And they have a pretty complicated means by which they can assess balance as well as mobility. Um, I think one that sticks out to me would be something called the anterior reach test. So in the anterior reach test, you're looking for symmetry side to side, especially if you're someone who has an injury history in your ankle. And how you perform this anterior reach test is begin by standing on one leg and then kind of sinking down into a single leg squat, but reaching out your other leg as far forwards as you can. And then putting down a little bit of a marker, whether that be you're pushing a floor slider or pushing a cup, or having someone tape the floor as far as you're able to reach. Then
So you're
bring
basically marking how far the leg that you're balancing on can stabilize and control, but you're reaching as far as you can with the other leg.
Exactly. And this is a cool test because it's measuring a couple of things. It's measuring your single leg balance as well as your ankle mobility. So if you see that you're symmetrical side to side, then you can try that same reach test in other directions. Usually the other directions would be backwards and then to the outside and then backwards and to the inside, kind of like a curtsy lunge. So
Yeah,
if you
and
do
it's almost
see,
like a
oh yeah,
star. Like if you imagine there's a star in front of you, you're trying to hit the different points of the star.
Yeah, and that's actually one of the exercises. So the test can become the exercise later on when you're trying to rehab or prevent injuries from occurring. Next, what you can do is if you do have an asymmetry, you can try and figure out, is this a mobility restriction or is this due to a balance discrepancy between each side? So
And let
one
me just
really,
clarify.
oh
Let
yeah,
me clarify for 1 second. So this is basically saying a different side to side. Someone reaches out, and let's say they get, X amount of centimeters, and they reach on the other side, and they get X amount of centimeters less. That would be the discrepancy, right? Comparing one side to the opposite.
yes, that's something that um, we don't have like amazing normative data, and there are a lot of other variables such as like leg lengths and things like that that can contribute to differences between individuals. But luckily, we've got 2 feet, right? We got 2 ankles, so we can compare side to side and see, well, this is my more normal side, and this is maybe my dodgy side. So I need to work on or test and see what my dodgy side looks like compared to my normal side. Like for me, I'm always trying to attain symmetry between my surgical ankle and my non-surgical ankle, because then I have my normal and I have my trying to be more normal side, right?
You're affected. Yeah.
Yeah, I don't like to say like my bad side. I think that's like a negative,
Nah.
framing. You could say my less good side or my side that I'm always,
My
working on or
ideal versus my non-ideal.
yeah, yeah, sure.
Whatever. Okay, so I get it. So they do this. Someone does this balance and reach, this anterior balance and reach, and they have a deficit on their left. They're standing on their left side. They're reaching with their right, and so they have a deficit on their left ankle. So you're mentioning, how do you determine like what's going on? Because there's a lot of things at play. As you mentioned, there's mobility and there's also coordination and strength.
Yeah, so I would say, so we're going to measure that left side. We'll call that the non-ideal side. And we're going to say that's with that anterior or reaching forward. What you can do is you can do what's called a toe to wall test. So stand facing a wall and bring your big toe on your left side up against the wall. Keep your whole foot on the ground, including your heel, and then slide your knee forward until that knee touches the wall. Once you've established that range of motion, we call that ankle dorsiflexion, then you can slide your foot backwards a couple of centimeters and then re-look at if you can still slide your knee towards the wall. And you do that as far as you can until eventually, when you're sliding your knee forwards, you'll find either some pressure in the front of your ankle or you'll feel tension in the musculature of the back of your ankle, and your heel will start to rise up. Once you get to the furthest point that your foot is away from the wall, that you're still able to slide that knee to the wall, you measure it. And then you compare that to your quote unquote ideal side. And you want to see a good similarity here. So that would be a test of your mobility, if you will, your ability to access that ankle dorsiflexion. And if you have a big discrepancy side to side with that test, then you know your big limiter is probably something in your mobility. So you need to do some ankle dorsiflexion stretches, or you need to do some ankle dorsiflexion mobility work. Really, again, the test can become the exercise. So you can, before and or after your climbing sessions, just do a couple of repeats of some calf stretching or some ankle mobility work in order to work on your ability to access that range of motion.
And I
So,
love how you break down that your failed test becomes the exercise, because you can do that single leg balancing and reaching, and that can be an exercise, right? If you don't do very well at it. Or you can break it down, distill it down, and say, no, my ankle is stiff. That was the reason why I'm not doing so well. Let me do this toe to wall or knee to wall assessment. And those are all super easy to track. Those are literally like centimeters or inches on the ground that you can just track over time. They're kind of hard to improve on. You have to be persistent, but I love the simplicity of it. And so, is there any other breakdowns? I mean, you do that balance and reach, and you're like, okay, maybe it's a stiff ankle, and I'm assuming that would be like the soleus muscle because the knee's bent, it doesn't cross the knee, or the
mhm.
joint capsule, of the ankle. Are there any other ways to tease out what's going on if someone can't do that balance and reach very well?
So the next component I would say would be to look at the function of your ankle and the neuromuscular system that controls that ankle. So that would be testing our balance. So simply stated, the easiest way in which we can test our balance is just standing on one foot. So there are three separate systems that we talk about in the article that keeps us upright and balancing in the gravitational plane. It's the reason that these systems and their relationship to one another is the reason that we can stand on one foot without just tipping over. Those three systems are our visual system, as well as our inner ear system and our proprioceptive system. So we as human beings, we devote a lot of brain real estate. Basically, the whole back of your brain is devoted to processing visual information. And this is one of the biggest systems that we use to keep ourselves upright and from falling over. Next, we have the proprioceptive system, which is a big fancy term for the system that looks at the information coming from receptors within our ankles and within the tissues of that ankle. So as we're standing on one foot, we'll kind of veer side to side, and we'll see that ankle kind of sway side to side as it auto corrects. And that auto correction is through the processing of information from those receptors that are within the tissues of the ankle. Now, I would say the proprioceptive system is a huge system that gets injured in people with ankle sprains and especially recurrent ankle sprains. And I'll talk in a second about how to differentiate and tease out which system is at play or which system we need to work on. The last system would be our inner ear system. So these are like the semicircular canals within our inner ear, also known as our vestibular system. So this is the one that, when you're on an elevator or you're on a ship, and your environment is the same, but you can feel that movement occurring. This is the system that's telling you that you're actually moving. So,
Yeah, it's a good way to describe those all.
yeah. Oh, thank you. Yeah, I've been working on it. I've been trying to work on
Yeah,
it.
that's solid. That's dialed in, and especially I love the elevator analogy, or even the cruise ship. Right? Is just that feeling, that sensation. But okay, continue on, continue on. I'm loving it.
Yeah. So the easiest one that we can tease out is our visual system. So standing on one leg, as long as you're safe, actually a door frame works really well for having two things beside you that you can grab onto if you find yourself falling over. Once you're able to just stand on one leg, then you can start to tease out these separate systems. So the easiest way, take out that visual system, stand on one leg. Once you find a nice center of balance, then shut your eyes and see what happens then. You'll find that it's actually much more difficult to stand on one leg without the input of that visual system. So we take out that system, and now we're relying on the proprioceptive system and the inner ear vestibular system. Next thing that we can do, we could, some people like to, like tease out the proprioceptive system. I'd say the proprioceptive system is the most commonly injured with an ankle sprain.
Mm.
You can tease it out by standing on like an Airex pad or like a foam pad. And in that case, you don't get as much feedback from the bottom of your foot. The fun one is to mess with your vestibular inner ear system. So in that scenario, you stand on one leg and then you can tilt your head backwards, which basically eliminates some of the use of some of those semicircular canals. And then part of training, again, the test becomes the exercise. You could challenge your visual processing system and your inner ear system by standing on one leg and then rotating the head side to side, as well as shaking your head up and down, making circles, etc. All these things
It's hard to
will,
do. It is
oh,
really hard to do, right? When you add in any one of those components, or you remove one of those components.
insanely difficult. And I would say start with the basics, like start with that single leg balance. If you find that you have to catch yourself in that door frame or put your other foot down, or you're really shaky and wonky, then you want to just start there. Just train yourself to be able to stand on one leg. And there was actually an article that's been floating around from the American Journal of Sports Medicine in which they had people just stand on a foam pad for 5 minutes. And this significantly reduced the recurrence of ankle sprains in high school football athletes. So this is something that's very easy that you can do at the end of your session, at the end of your bouldering or climbing session. If you say, "Oh yeah, it's just a thing that happens. I sprain my ankle every bouldering season," or something like that, that should not be the case. And I would encourage those individuals to kind of do something about it. You know, find the article, type in ankle sprain and rock climbing, and go through some of those exercises that we've got there. You know, we made some videos. It was COVID era, so I've got like COVID hair and stuff. So I'm all like unkempt and I've got long hair that's all shaggy and
Oh, you
stuff.
look classy though. You're styling. You have a button down. You're probably like the most fashionable in all, or the most formally dressed in all the videos on the blog. But
I was super new to practice and everything, so I was like, I better make this look good, you know.
oh,
So
look, it was dialed in.
I tried to dial it in for you for all the people in here.
Um, nice. Question: are there any norms? So, someone's doing the single leg balance reach. They are like, I'm really bad at this on one leg. They test their knee to wall or ankle to wall, and they're like, oh, this is similar side to side. I'm fine. And they're like, all right, let me test these three different systems. Balancing on one leg, balancing on a foam pad, and then like maybe moving the head side to side. Are there any general norms that you can give that's like, obviously you can compare side to side, but there's any like benchmark where we're like, oh yeah, if you can do it this long, you're probably okay? Or do you just recommend compare within yourself?
I think I think number one would be look for symmetry, and then I was once
Unless you've
familiar with
sprained
these.
both ankles, then you're in trouble.
That actually did happen to a buddy of mine. We're the gym that we've got up here in Summit County is pretty one could say pure. Um, so the
Oh, I don't like those words, especially when you talk about a climbing gym.
it's old school, you know. It's kind of like Rocky 2 when he
Yeah.
goes into the gym and it's like pretty dirty and like dark and stuff, and all these people are looking at you weird. Like that's the Summit County gym, which is I love this gym, you know.
No,
And
it's a
once you
good.
get
It's a certain like style. I think that. I mean, you and me have both been climbing for a while, and I love gyms like that. I just know they're sandbag like crazy, but I just
oh yeah,
love gyms like that.
yeah, it's like built into the culture. Like V2 is like
Yeah.
not easy, and I'm a volunteer setter there, so I'm like part of the problem, you know. So if you come into the Summit County climbing gym and you see a setter Dr. Nice, I'm sorry.
Yeah. V2 equals V7. But
Yeah, yeah. Um, so one of my buddies in the gym did fall, and the mats were pretty worn out. They've since been replaced, but he did sprain both ankles pretty bad, um, to the point where he was in like a soft cast on one side and then a functional ankle brace on the other opposite side.
oh, wow. Yeah. So okay. So back to the norms then,
Oh
and
yeah.
yeah. So
I'll,
yeah. So unless you're like your buddy and you've injured, functional ankle brace, soft cast, different ankles, should people focus on norms, or do you say there's so much variability and difference?
some of the norms that I may be misremembering these, but I believe some of the norms were between 45 and 60 seconds for single leg stance with eyes open. And then you want to shoot for between 10 to 20 seconds without using an assistance. So without grabbing that door frame, without putting the other foot down, and without like a huge wild swinging of the arms with the eyes closed. So I would shoot for those two norms, 45 seconds to a minute with eyes open, and then 10 to 20 seconds with the eyes closed, um, as far as our
And
normative
and what are
data.
your Yeah, and what are your thoughts on transitioning that to like function, as in, should someone get on like a 5-4 slab, maybe on top rope, and and close their eyes and like feel it? Should they like get on a slab
Oh.
and like move their head side to side and really like challenge that way? Should they then jump in an ice bath with the bottom of their feet so they're numb and then get on a slab so they don't have that that sensation, like, or you're like, nah, like just train this in isolation, don't get too fancy with it?
You know, I think obviously the most specific training that we can have would be rock climbing, right? Now, luckily with rock climbing, usually our goals are above us as opposed to below us. So it is really important to establish that foundation of being able to balance on one leg with your eyes closed, because typically when we are jumping for a hold, we are looking at that hold. We're not looking at our landing zone while we're performing a dynamic movement, right? So we have to be prepared to land without the input from our visual system. So training that by hopping on one leg, like while looking in a different direction or something like that, would be beneficial. And then in the article, one progressive way that you can challenge this would be campus, like a campus run or campus board. So slowly increasing the distance you go up that, and then falling without any pain or discomfort, and also by landing as softly as possible. So you don't want that like elephant fell over in the gym kind of landing. You want to have as soft a landing as possible so that you're absorbing that shock in a very beneficial way. And then, in that article as well, we have things like the climbing star drill. So taking that standing star drill and then applying it to rock climbing. And I think reintegrating that intuitive sense and that feel for the ankle and different footholds can be really beneficial, and really try to train that system to once again dial in and fine tune pressures in the big toe and in the ankle. I know that you've written some cool articles and had some good posts on like the flexor hallucis longus, or the thing that points our
Yeah.
big toe downwards. And all these things need to be brought back online after that significant ankle injury. So yeah, like working on these things on the wall is going to be the best thing, as far as getting back to climbing at a super high level and not compensating around that injury, which you mentioned earlier.
Got it. So, all right. So we have, we kind of start off talking about how important it is to assess or address the ankle, right? We jumped into ways to actually assess, how your ankle is doing, the stability of it through that balance and reach, and then how to further break that down into whether it's mobility or some other systems in our body. Well, now when we get an injury, like if that does
Yeah.
happen or someone does injure their ankle, and this is really the article that you wrote, on the page, and people can reference the article. Obviously, we'll have that in the show notes. And I know the first part you talk about is one is determining whether it's something you have to go to the emergency room for. Like you just like me, you just like, pendulum into the wall and hyper bent your ankle, or you fell from a boulder problem and your ankle rolled inward typically. And now you're like, oh no, what do I do next? You talked about some of the rules that have been documented in literature. Do you want to just briefly touch on that? Because I think that's really tangible. If someone's listening to this episode and they've just injured their ankle, they can use research to guide whether or not they need to go in to see a physician, which is likely different than seeing, a chiropractor, a physical therapist, an athletic trainer, right? Because if you're seeing a physician, you're determining whether or not this is something that's severe past, rehabilitation. But yeah, maybe break down some of those rules, and then we'll briefly touch upon some of the stages of exercises.
Yeah, and this is something that I think is it's a really easy set of quote unquote rules. And they're called the Ottawa ankle rules because they were developed in Ottawa, Canada, and they are found to be very, very sensitive to really bad stuff. In this case, the bad stuff would be an ankle fracture. So the thing that you want to make sure, number one, is did you break your ankle? Because it doesn't matter if you see me or you, if you've got a fractured ankle, I don't care how great your partial loading stage of your
See you
rehabilitation is,
later. Yeah.
it's not going to go well. You're going to go weeks and weeks and be like, yeah, I don't know why my ankle's like still bugging me like this and why it's still all swollen and stuff. So
But
those
but these
Ottawa,
are the same. I mean, these rules that you're talking about, these are the same ones that you or me would do in our assessments to say, hey, no, you need to go see a physician and get an image.
oh yeah, and I actually have a specific story that I'd like to share regarding these ankle rules as well. So the number one thing is that individual, or are you able to walk 4 steps without a significant amount of assistance? So if somebody falls off a boulder and they're able to kind of like limp around and do stuff like that, then they're probably okay. That's one of the rules. Okay. The next
And
one,
what's a step? What's a step? Does it mean
oh, okay.
a step through or a step to?
So limping is okay. So step
Okay.
two is kind of on that verge, but luckily we have a couple of other aspects to these rules that we can also employ as well. Because I have had an ankle fracture literally walk into my clinic. We're really lucky in my clinic, we have x-ray capabilities. So I have had an
Hmm.
ankle fracture literally walk into the clinic before. Um, the next one is to press on a few bony prominences of the ankle. So in the ankle, we've got
Oh
our,
yeah, maybe pull up for people who are watching. I
yeah,
know people are listening too, but this may be a good thing to pull up. And if you're listening, maybe check the show notes for the diagram. But this may be a nice thing to view. And I can pull it up also, Nick, if you need a
I
eyeball on
think.
it. Oh no, perfect. Okay.
Okay, so you can see it see it well.
Yeah, I can see your screen, and then if you scroll upwards a little bit.
Oh, there we go. So these are the Ottawa ankle rules. So you need to have the ability to walk 4 steps without assistance. So that's number one. Each foot strike counts as a step, and yes, limping counts, but you can't use assistance from your friends or crutches. Next, we want to press on a few bony prominences. So we have these bumps on the inside and the outside of our ankle called our medial and lateral malleoli. So you want to press on the back of each of these bumps on the inside and outside of your ankle, respectively. So you want to press approximately 6 centimeters along the very end of those bumps. And you want to press on the back where you feel it being pretty hard, kind of like a bone. And so you don't want to be pressing necessarily on the soft tissues like the Achilles tendon or the fibularis musculature, but press on that hard part. Remember, you're trying to figure out if there is a break there. So if it's a bone, you should be able to press on that pretty well and pretty decently without getting a significant amount of pain.
Yeah,
Next,
and these
if
are
you,
basically the side ankle bones, the inside
yes,
and outside ankle bones, the things that stick
exactly.
out, little teardrops at the bottom of your lower leg.
Yes, exactly right. Next thing that you want to do is you want to work your way along the outside of the foot until the side and outside of the foot until you feel a little bony bump. And that would be the base of your fifth metatarsal. And you want to press on that because that's an area that's actually quite prone to fractures. There are three different fractures that can occur at that site, especially as we're falling from a height. So a lot of gymnasts get fractures there and stuff like that. But rock climbing, especially competition rock climbing, is fairly akin to gymnastics nowadays. So rock climbers can also get fractures there. And then we want to do the same thing with the inside arch of the foot. So pressing on a bone called the navicular. And this is about where the top of your arch is. So you want to press around the top of the arch. And I would say, really, if there's any question, then it's better to be safe than sorry. So I had a patient come in, and again, they walked into the office and they were playing soccer. I got their permission before I, did any of this stuff. And they were playing soccer, and their foot went into a hole, and then they pivoted and felt a pop in their ankle. They came in, they had a bunch of swelling in their ankle, pretty
Hmm.
classic for an inversion ankle sprain. And then I did these Ottawa ankle rules, and they had palpatory tenderness or tenderness to touch on the outside of their outside ankle bone. So the posterior aspect of their fibula, their distal fibula. And I honestly did not really feel like doing an x-ray that day. But I did the x-ray, and turns out they had actually they had spiral fractured their fibula, which they were able to walk around because the fibula is largely a non-weight bearing bone. It bears about 10% of your weight during the gait cycle. So if there's any doubt, I really recommend somebody go and get further imaging. It's kind of like epiphyseal growth plate fractures in youth climbers. If there's a doubt in a youth climber, of growth plate injury, you want to go get an image so that then honestly you just don't look like a buffoon trying to conservatively manage something that's actually broken.
Yeah, and when in doubt, check it out,
Yeah,
right?
that
So
yeah,
even if a climber doesn't go in to see a medical provider, they can have self-assessments or can perform self-assessments.
mhm. And if any of these spots are exquisitely tender, you may be wondering, what does exquisitely tender mean? You'll know it when you see it because usually you'll see some pretty distinct facial changes, maybe an auditory response to the pressing of these locations. So I think that's a huge component. Like, make sure you're not trying to
Got
rehab a
it.
broken ankle. That's just not going to be fun for anybody. All
So
right.
a climber has an ankle sprain. They've touched these different points of their ankle. They've walked, a step through pattern, a normal pattern.
Yeah.
Everything's fine. They're okay. What are the stages? And what we can do, we can kind of be brief with these so people can then just use this as an outline, but then if they want to get in depth, they can check out the article. But outline kind of the stages of rehab, and then we can kind of get into maybe some of the highlights. And you've talked about some of these exercises already.
Yeah, so the first stage, this follows the rock rehab pyramid that you so eloquently devised. The first stage is like, oh yeah, it hurts really bad to stand up and things like that. That we would put you in the unload stage or the unload category, where yeah, you're able to walk 4 steps, but it's pretty uncomfortable. So we want to start to rehab you without any like a significant amount of weight on that ankle. So just being on your back and doing things like ankle pumps and ankle circles can be a great way to start moving around that ankle without putting too much load into it. Now, this movement is going to help with the clearance of inflammation as well as return range of motion, which we really want to get back as soon as possible in the ankle. One thing to note, there's not really a RICE stage, rest, ice, compression, and elevation. And if you look at some of the articles like Verberg et al. And others, they really assessed whether that protocol was the most beneficial protocol or if it adds to or speeds up the rehabilitation process. And what they found that it really wasn't a huge priority or a thing that's really going to give you a lot of bang for your buck in the rehabilitation process. So in the unload stage, movement is medicine, motion is lotion. We want to be doing things like movement to tolerance as long as it's not worsening your symptoms. After we get to
Yeah,
where
that's
we
that's good
can,
advice.
oh, thank you. Yeah. And then once we get to being able to do that and maybe load and maybe put our foot on the ground without too much discomfort, we can move to what's called the partial loading stage. And I've got to start it out with a pretty cool exercise developed by Vladimir Janda out in the Czech Republic called the short foot exercise. It is a little bit of a complicated exercise, but it basically has you working some of the intrinsic muscles within your foot. And again, this is going to help with clearance of inflammation and get good blood flow to that musculature so they can heal as quickly as possible. Next would be the toe yoga exercise. So you're seated in a chair and then you're alternating, lifting up the toes, whether it's just the big toe or just the lesser toes, or lifting up all of your toes and then putting down just your big toe or just your lesser toes. So another great way to get good blood flow and range of motion, as well as control of your toes. And that control comes with the activation of the intrinsic muscles of the foot. I'm always kind of surprised when I do have individuals who have an injury to the foot, maybe a non-traumatic injury, and then they have zero ability to move their toes independently of one another. So kind of like our hand, our thumb can move quite well independently of our other fingers. Your big toe ought to be able to move independently of the other toes because we have accessory and very small muscles that go straight to that big toe. So they should be able to move independently of one another. Next, we get to the initial loading stage with something like a weighted or a banded seated calf raise. So again, another way that we can just start stacking a little bit of load to tolerance. So we want to make sure that it's not something where you have a bunch of pain during. So if you're going up to a 5 or a 6 out of 10 on the pain scale, 0 being no pain at all, 10 being like giving birth or like the worst pain you can ever imagine, something like stepping on a Lego or something like that, then you can kind of keep going right there. We also want to make sure that we don't have lingering pain. So if you're doing any of these exercises and then you're like, oh yeah, I did the initial loading stage, and I put a 50-pound dumbbell on my knee and I was doing my seated ankle pumps, but then my ankle was really sore that night and the next morning, then we probably need to back it off and just have a little bit more patience with our rehabilitation. Let's see. Oh, next, this is a really fun one, the balance stuff. So we worked on single leg balance here, as well as single leg balance with the eyes closed. Now, I will say to the testament of everybody in this video, we were on a foam like gym floor. So there is a reason
Which is
that everybody
hard.
kind of,
That's hard to do.
yeah, it adds another layer of difficulty to the exercise. So that's why everybody fell over when they shut their eyes. I've been working on it for a while, so I think I just opened my eyes. I think I cheated when I did that. And then next would be the star drill, which you can start either with a support on the wall, or you can start without support, depending on how good your balance is after the injury. Let's see. And then you can apply that to rock climbing. So I really like being really low to the ground and then working on just weighting different footholds, especially if that's uncomfortable. So then you can redevelop and fine tune that finesse that's necessary to utilize very small footholds. Let's see. Oh, and then once you've gone through those partial loading stages and you're like, man, my ankle feels great. I can walk, I can climb without any discomfort. Remember, the rehabilitation process is not over because we have to get ready to fall again, right? Whether that be falling on the boulder or pendulum swinging and kind of getting spiked into the wall, which hopefully doesn't happen, but unfortunately it does happen. So we want to be able to hop on one foot and not have any pain or discomfort. Once you're able to hop on one foot without any pain, just up and down, then hopping side to side, forwards, backwards, maybe hopping in a figure 8 pattern or whatever your favorite pattern is. So that's how you can start with the quote unquote dynamic and plyometric stage. And this stage is crucial, in my opinion, to really decreasing the recurrence of ankle sprains. Because, like I said, with a grade 2 or even a grade 3 ankle sprain, we've now had an injury to that proprioceptive system. So the information that's going up to your brain has been altered somewhat. So we need to redial in that information that's going up to our brains. And then the last thing is fear avoidance. The only thing to fear is fear itself, that famous FDR quote, right? So we want to work on falling. And if you're really afraid to fall, then working on that in a nice controlled fashion can be done with things like campus rungs and like foot on, like climbing up to a predetermined height and then falling down in a nice controlled fashion and building up not only the physical tolerance in the ankle, but also the mental tolerance to being able to fall from a height. And then once you've graduated from falling from the nice, stable, controlled environment of the campus rungs, you can now go out to the bouldering gym again, and you can go to a really easy problem and then practice falling from different body positions, different body tensions, and then varying the height and following from different heights as well. And then from there, you can start working on more and more difficult problems to where now maybe you're not taking as controlled of a fall, but you're working more on your top end performance. And then the fall is just something that occurs as a result of rock climbing.
Yeah, I love that. I love that. Well, yeah, go ahead. Let's unshare the screen. And you know, I really like this process. I've gotten a lot of great feedback. You know, people have sent me emails and messages about this article that it just very
Oh,
clearly lays out everything.
right on.
And yeah. And I think what will be great is this episode too not only will be like a good adjunct to the article, but even what we talked about on prevention ends. I think anyone's listening that's maybe sprained their ankle in the past and are like, oh, I gotta, dial it in a little bit. I think even some of the exercises in your article for an ankle sprain, like those later exercises, are good just for prevention. So nicely done with that. Are there any closing words that you have, on the topic of, ankle sprains and rock climbing that you want to share to people who are watching and listening?
Ooh, I mean, the biggest thing is I'd like for people to have that kind of like bird's eye view, like pick up on some of those patterns. Like, oh yeah, it's just, you don't need to just shrug off that you sprain your ankle once a year. Some of these things are not super normal. Like, oh yeah, every time I go for a run in the spring after, like, one thing that I see a bunch is, people are skiing in a ski boot all winter, and then they go out and do a bunch of trail running and rock climbing and things like that, where now we're not in that, functionally, like, no movement scenario. And then it's like, oh yeah, I just sprained my ankle. It's like, we really need to key into that and then devote just a small amount of time consistently to building up that ankle again, and getting that to be normal, whether that be normal in terms of range of motion or its capacity with balance or its capacity with that plyometric stage and jumping, etc. Because nobody wants that to progress to having chronic ankle instability and then arthritic changes down the line. So, you know, uh, don't get wrapped up in that pattern of being injured once a year. And then if you're having difficulty with rehabilitating this, then seek the help of a certified professional, whether that be a physical therapist, a sports oriented or rehabilitation oriented chiropractor, a really good athletic trainer, a really good personal trainer, even all those different things. All those different individuals can help guide you. And it's okay to ask for help in this process as well. One of the reasons that I'm really happy that I was able to write this article is because a lot of times I do see friends in the gym and they kind of shrug off this ankle sprain, and I tell them, like, no, you need to go read this article on Jared's website, and you need to go through these rehabilitation protocols so that we can make sure this isn't something that becomes a consistent problem over time.
Absolutely. Well, where can people find you? Where's the best place if they want to track you down?
They can always email me at drhedges93@gmail.com. And I've actually started up a podcast myself, all about injury prevention. So I've got an
Heck
ankle
yeah.
sprain episode, and I think about the time that this episode comes out, I've got this really awesome guest named Jared Vagey on
Oh
my
yeah, we
podcast.
did, yeah.
So I'm gonna start
That was
compiling a
fun. That
bunch
was a
of
good one.
yeah, I thought it was amazing, and we're gonna bring out a lot more information for rock climbers so that we can hopefully prevent these preventable injuries. So that's Art of Prevention. You can find it on Spotify and Apple and all that jazz. So I think
Awesome.
artofprevention.info@gmail.com is the Gmail for that. Artofprevention.org is the website there, and you can find us on Spotify and all that good stuff. I think there's an Instagram
Cool.
too.
Well,
Yeah.
art of prevention for the
Yes.
Instagram.
Mm-hmm.
Cool. We'll put all that in the show notes so people can track you down and follow up. And not just ankle injuries, any injuries.
Yes. Yes.
Dr. Nick's got it covered. Always a pleasure. Good connecting with you. And hopefully we'll get to meet again in person sometime. It wasn't too long ago. Maybe a couple, was it 4 months ago, 5 months ago?
Oh yeah, and Golden for the clinical
And
management of the rock climber course. That was an amazing course. That was
that
just
was
so good.
fun. That was a good time. I got to watch you crush it on some boulders afterwards. So
Yeah, that was
boulder
great.
problems afterward.
And maybe this summer
All right.
at the rock climbing convention thing in Lander. I got to see what my schedule's looking like. I'm planning on opening up my own practice, so I'm going to be a little bit busy, but we'll see.
Cool. Well, stay tuned. Stay tuned. All right. It's always a pleasure. Take care, man.